Yes, here in Studio A this morning, as I mentioned, from San Juan Regional Medical Center. Welcome back to KSJE. Dr. Brad Scoggins is here from San Juan Health Partners Pediatrics. Dr. Scoggins, good morning.
Good morning.
Good to have you back.
Wonderful to be here. Thank you.
Thank you for coming in. Melanie Stout is also here. She is the manager of the Pediatrics Unit at San Juan Regional Medical Center. Melanie, good morning to you.
Good morning.
And welcome back to you to KSJE.
Thanks for having me.
Great to have you both here this morning. And as we've been talking before we came on the air this morning, gosh, it's been almost a year since the opening of the newly remodeled Pediatrics Unit at the hospital. So congratulations. And I guess with a year under your belts, how are things going? Is it working as designed?
I would say so. Yeah, it's been great, and thankfully for most of the year for pediatrics, our census for kids is fairly low.
Right.
So it's given us a chance to kind of find our bearings and find out where to store things compared to where they used to be. But I'd say things are going great.
Very good. And this redesign, this renovation was pretty major, wasn't it? If I remember our previous conversations about it, it was a multi-million-dollar project, if I recall.
I think it was bumping up on $1 million probably.
Okay.
And yes, it gave us capacity to handle a few more acutely ill children or more acutely ill children. It gave us private bathrooms in all the rooms. A big upgrade, especially for parents who are having to stay with their sick children.
Gotcha. Which was not available before.
Not in any sort of comfort.
Right.
Yeah.
Right. And so that has worked out pretty well, or very well.
I would say
It's been amazing.
Yeah.
We've had our parents love the decorations. Even some of the adults that we take care of on the unit really like the environment. And just this past year, it's just been amazing. I just want to thank everybody that played a part in that. So we have a special team of pediatric nurses that are trained to take care of kids, kind of a general peds / subacute, maybe peds unit, and then we work really hard with our nursing professional development team, our group of educators, that we keep up with competencies so that we can safely care for our kids. So our parents are thankful that they don't have to fly if they don't have to, and in an environment that's actually really nice. So
right.
We're excited.
Very, very true. We're showing some photos of the unit after some of the renovations. Obviously, a hot air balloon theme happening there.
Of course.
that we can see. But lots of new colors and just different things, I guess, to make, if you have to be in the hospital as a kid, to make the stay maybe a little less
traumatic,
annoying, traumatic, whatever the
Right.
case may be, right?
Yeah, absolutely.
And I guess that's the other question I had for you, Dr. Scoggins, this morning is, for children, when they're sick, I think for any of us when we're sick, I mean, we don't hear about a lot of long hospital stays. I think the goal is to maybe get folks home as soon as you can to continue recovery. So if a child is ill enough to have to be admitted, they're probably pretty sick. Is that an accurate statement?
Yes, in general, I would say it is, and that there are fairly tight criteria for who meets inpatient level of care needs.
Right.
So yeah, you would have to be relatively ill.
Right. And as they recover, then I guess the idea is not to have them in a old-fashioned hospital gray room and things like that. And that was maybe the reason behind some of these design changes and renovations.
Mm-hmm. Yeah, absolutely. More bright, lots of colors, enticing you to activity and to return to your baseline.
Right.
Yeah.
Right. And I would think there's probably some studies about how that may help kids get better faster, or any of us get better faster if we're in surroundings that are more conducive to positive feelings and healing and those types of things.
Mm-hmm.
Definitely. We've got an actual playroom that kids can, obviously, if they're not in isolation, go play. And we were excited to put a Christmas tree in there. Just some different things. It's like moving in a new house. Oh, goodness, we could put this there.
You have room
This
for
will be
this now.
perfect.
Right.
Yeah, exactly.
Right.
A fish tank that actually is a popular item, and the kids, when they're walking around aerating those lungs, they can walk by and feed the fish. So it's actually really cool.
Right. I think we have a picture of it on the
Yes,
screen
there's our
right now,
playroom.
right? Before the tree went up.
Yes.
But that's what we're talking about. And I guess the idea to maybe get kids out of bed when they're ready and move around a little bit and be able to go down to the playroom and maybe play with another patient who's able to do the same thing. This is all part of the healing process.
Absolutely. Yeah, the quicker kids can start to act more like themselves, the quicker they'll get better.
Right. And I imagine mom and dad are happy to see that too, right? When
Generally.
their kids get more back to normal,
Yes.
whatever that is, right?
Right.
But want to get out of the bed and go down and maybe play with some toys that are in the playroom and things like that.
Yes.
So very.
One of the other things,
good.
sorry,
That's all right.
that we do offer is our pediatric outpatient. We have a treatment room, so we can take care of kids that maybe don't need hospitalization. They just need some IV fluids or labs or something. We're able to take care of them
Right.
just for a few hours type thing. So it's
Right.
nice.
Very good. And with some of the staff that you've gathered and grown at the pediatrics unit, you were mentioning some about being able to care for maybe more acute cases, and I think that's probably important for families to understand that maybe if their child is ill, seriously ill, that they wouldn't have to maybe make a trip out of town to get treatment for their children, and that's kind of the idea.
Absolutely, yeah. We really go out of our way to make sure that we've got, that we invest in existing technologies, that we make sure our staff is well trained and ready to accommodate those needs. So we do have an ever-growing complement of those staff members in hopes that patients won't have to travel unless it's absolutely necessary. Now, unfortunately, necessity for transfers does happen.
Sure.
But yeah, part of the reason for wanting to come in here and talk with you is to talk about those expanded services and to remind people in the community that we have the only dedicated pediatric unit in the Four Corners. We have dedicated pediatric hospitalists, we have pediatric nurses, we have respiratory therapy staff that are good with children. So we're able to take a large percentage of those that historically would have probably been transferred to Albuquerque. And just in the break before we jumped on, I was discussing how a lot of the respiratory illnesses from last fall really overburden the tertiary care children's hospitals because so many pediatric units have been shutting down across the country, and that's been a trend for several years now. So we're doing our best to make sure that we meet the needs of the community and try to take some of the burden where it's appropriate off of those tertiary care hospitals.
Right, very important. And I guess with the staff that you have that's trained in pediatric care, I mean, because it's quite different when you're treating a child than treating an adult. I mean, there's just different things. There are different sizes, different things to be aware of. Some of many things that I'm not even thinking about because I'm not a doctor, but you are, and
Right.
so it's different. It's just different.
It's very different, and Melanie can, I'm sure, speak to this too. But
Yeah.
back when I was a paramedic, I was terrified of kids. So I've come a long way.
Because
I always like to say, yeah.
just because of the difference in treating them.
Yes, because their physiology is different.
Because you ended
their
up having
anatomy is
kids
different.
yourself, so you got over that fear.
Indeed, yes.
Yes, sir.
Indeed,
Yes,
yes. And maybe well past that fear, yes.
Right.
Yes, but yeah, everything's different about them. Anatomy, physiology, disease processes, everything.
Right.
Yeah.
Melanie?
Just anticipating what could come next and really incorporating family into the care, being empathetic with what they might be scared of. A lot of these kids that we see have underlying illnesses. Maybe they see a specialist in Albuquerque or Phoenix, and we just want to reassure them that they are going to get the care that they need, that the pediatrician is in close contact with their specialist, and just really keeping them up to date with how their care is going. So
Right. And the remodeling, as we mentioned briefly at the beginning of the program, too, maybe assists and helps if parents want to stay
Oh, yeah.
with their children in that room. Now that the rooms are remodeled, that's an easier situation then
Yes,
than it
and
was
we-
before.
Yes, and
You're
we
not sleeping in an upright chair.
Exactly.
Right.
We have some really, really nice Teresa Becker and her team sleep chairs that we got 12 of them, and they are very, very nice for parents to sleep in. So.
Yeah, sleep sofas. I'm looking at that photo there.
Right.
The sleep sofas actually came in a little after that was taken, but they convert into a desk that parents can sit and work at, and then at night they fold down into a decent bed. And parents have repeatedly told me that they're relatively comfortable.
Okay. Well, that's
Yeah.
good to hear, right? And certainly convenient. And again, if a parent wants to be there for most of the day, I mean, and maybe get some work done and things like that. I mean, while the child is napping or resting, what have you, it makes that available too.
It does.
So that's important for folks. I know security is another important thing at the hospital, notwithstanding, but also on the pediatric floor. And that's another thing that was part of this renovation, if I remember correctly, right? Is being able to secure the floor and know who's coming in and who's coming out and things like that.
That's right. Historically, childbirth units have been locked for obvious reasons. I hope I can say obvious reasons.
Yes.
There was always a question, well, pediatric unit is unlocked, and a lot of times we do have adult patients on the unit as well. So, yeah, security often comes up. The doors you're seeing there in the photograph are locked at all times. They require badge access or permission from the unit secretary or nurse to let them in.
Right.
So when visitors come in, they can just pick up the phone. The phone was installed on the right there, and we can let them in when they tell us who they're there to visit. So
gotcha. Important to know.
Yes.
Dr. Scoggins, I want to come back to you and ask you a bit about kind of some of the illnesses that you're seeing maybe in the practice this time of year. I mean, we hear about it's flu season, of course, but what else are patients showing up with?
Yeah, absolutely. Wintertime is the time for illnesses, so I'll put a shameless plug in here for coming to make sure your kids are caught up on their vaccines. But just about every illness that we tend to see in pediatrics will present itself in the wintertime. And there's a number of reasons for that, and still, honestly, some ongoing areas of research for why that happens. But we see RSV, or respiratory syncytial virus. We have some kids with pneumonias. We have influenza. We have parainfluenza. There's probably about 200 different viruses that cause upper respiratory infections in all of us, and kids tend to run through those. They get on average one per month, resulting in somewhere from 12 to 20 respiratory viruses per year.
Got it.
So, yeah.
And do those spread fairly easily, or does it depend on what we're talking about?
Some things are more infectious than others, and some things are more virulent than others. So the more virulent they are, the more likely they are to cause significant, more acuity in the illness when you do contract it, while others spread quickly but are not terribly virulent, and they just result in a cold. In fact, we could even say of most of those viruses, even the ones that I mentioned before, RSV and influenza, most of them tend to be fairly mild. But we have to be ready for those cases that go beyond that.
Right. Or I guess those individual kids that maybe have a harder time with some of those than others, or maybe they have some existing lung issues, which could make it a harder time for them, I suppose.
Absolutely.
But very good. And again, we're not seeing as much COVID anymore, I hope.
We are seeing
That's
some.
me knocking on the wooden
Yes,
table.
and I'm glad you did.
Yes.
We have not seen a lot of hospitalized COVID. Thankfully, that one among our pediatric population has been fairly innocuous.
Okay.
We've, of course, had some bad cases, but
Sure.
in general, it's been a lot.
It's still
more
out there.
manageable.
We shouldn't forget about it.
Don't forget about it.
Right.
Yeah, that's true.
And so that's an important thing as well. We're not seeing. I'm not seeing as many masks as we were. Of course, folks can still have the option, I think, of doing that if they're traveling or what have you. But that, I think, taught us a lot about how maybe diseases and viruses spread among a population, even colds and flu. When we were in the peak of masking and things like that, we weren't seeing as much of those diseases and viruses moving around.
Right. Yeah. Certainly during the lockdowns, when people were kept separate from each other by sheer physical space, staying in their homes. Now, it's also worth mentioning the downside of those lockdowns. Also, the mental health that's come out of that is continuing to be a plague, frankly. Physical distance, but I think one of the key takeaways is good, adequate hand washing, making sure you keep your cough covered, even if you're just coughing into the bend of your elbow.
Right.
That works really well. I encourage all kids, when I send them back to school, even as they're starting to feel better, make sure you cough into your sleeve or into the bend of your
rather than
elbow.
your hand, and then you're going to touch something or somebody,
or
and that's
shake
not
a
going to
hand
help.
or touch a doorknob or
Right. That's the idea. But that does seem to help, and that's kind of the message that we've heard even since I was a little kid, right? Is to wash your hands and keep your germs to yourself, kind of a thing. If you think about it that way,
and then make sure your immune system's ready to deal with them when they come along. I mean, the key pieces that should be there to help keep you from getting sick are adequate sleep, adequate nutrition, regular exercise. If you can take care of those three big things, for the most part, your immune system will be ready.
right? And for children, how does that fit? I mean, I think I don't have children, but I would think they love to sleep. I don't know. Maybe they do. Maybe they don't. Maybe not. Maybe
depends
not
on the
Christmas.
age.
Maybe not Christmas morning. But you know, that's one thing that you mentioned. Nutrition, I think, is always an issue for kids. We always are concerned, I think, about junk food and things along that line. So that's probably an area of concern.
It is, yes, and these are things that we try to drive home from the very earliest of days. I mean, I'm talking to parents about trying to get their kids working on sleeping through the night at about 3 or 4 months of age. When they hit the magic weight of about 12 pounds, they have enough glycogen stores in their liver and enough fatty deposits that they can tolerate an overnight fast. So the quicker we can introduce those good healthy continuous sleep habits, and for those babies, 12 to 14 hours continuous sleep is what's desired.
Oh, and parents are probably waiting for that moment.
Indeed. Yes, with bated breath usually. Yes.
Keyword continuous sleep, I think, there in what you
Right.
said. So that's important. Melanie, anything to add to these things for keeping kids healthy and the immune system healthy?
I think those are all important points, and I would add, for hospitalized kids, we are at the very get-go teaching those habits from the very beginning. So always anticipating what they're going to be dealing with when they go home. Make sure you push fluids. This is what you should, we shouldn't have Coke in a bottle,
Right.
that type of thing.
Right.
These are the healthy choices. So yeah, it starts from the very beginning.
Right.
Yeah.
And those things do really impact the immune systems, as you mentioned, Dr. Scoggins, and can maybe keep kids healthy, or if they get sick, maybe not as sick as they could if they had a weaker
Absolutely.
system.
Yeah, the thing I always remind parents of is you will not be able to prevent your kid from getting sick. Number one, and number two, nor should you try to keep them from getting sick. It's really important to the development of our immune system that it's challenged by viruses. It's challenged by dirt and dust and pet dander. So actually having dogs in the house has repeatedly been shown to help calm that immune system down from being so overreactive to everything.
Interesting.
If kids don't get their requisite number of viruses and acute illnesses when they're younger, we see a big surge in things like allergic rhinitis or nasal allergies, asthma, eczema, and then, worst case, and I worry about a little bit of this coming out of the pandemic, is I worry about a big surge in autoimmune diseases, which we've already been seeing over the last few decades. So keeping those immune systems challenged, I always tell people, don't let your immune system get bored, particularly when you're young, because it will look for things to do.
Right. But and many of those things would happen probably just in the normal course of living, right? You're not asking folks to go out and touch everything that they find.
No,
things like
I
that,
recall
right?
Dwight Schrute from The Office licking door handles.
No.
I don't recommend that
all right.
as a matter of course.
All
yeah.
right, fair enough. That may overload your immune system, I would
Right,
think,
yeah,
on multiple ways.
Right.
And so that's an important distinction, I think. But
Yeah.
but it is part of a normal, or should be part of a normal childhood growing up experiences, right? To be exposed to other children. I mean, obviously schools do that pretty well in sports and youth sports and things like that that kids are involved with. And so all that should happen just by design, I would imagine. But of course, things have changed a little bit in the last few years, and so it's important for parents maybe to understand what that means.
Right. Yes. So that's a big part of our job, at least in office-based pediatrics, is kind of catching people up to, okay, this is how things are with a social being like human beings, and the viruses we're not going to get away from.
Right.
So take reasonable risks is how I phrase it.
There you go. And but for a kid to get sick is just part of growing up. It sounds
is.
like.
Yes.
To me. And but knowing that if they get really sick or have a serious medical condition, we have this new pediatrics unit at the hospital and the staff that's trained. It's not just the beautiful rooms and decorations, but it's the staff behind all that too that is going to keep kids healthy, get them back on the playground and things like that.
Yes, and I would say our pediatric staff has a heart for kids. They love taking care of their kids. And not that we want to see sick children, but we love the opportunity to be there for families. And this is such a small community, so you end up knowing a lot of the people that you see, and to be able to play a part in their healing, whatever they're going through, is really profound, and we're honored to do that.
Right. Dr. Scoggins, you mentioned that the fact that the San Juan Regional Medical Center has the only dedicated pediatrics unit in the region, and so I would think that this message would be important for folks outside of San Juan County to hear as well, and so maybe that they know that this resource is here and they don't have to go to maybe Grand Junction or Albuquerque or Denver, nothing wrong with any of those places, but that maybe the care they need is closer than they think.
Absolutely, yes, and we're delighted that those places exist, because there are patients beyond our capacity to care for, and so recognizing that is a big part of our jobs. But yes, we are actively looking to expand services. We're looking to put another project that's kind of in the works is looking at more telemedicine capability to bring some specialists, to teleport some specialists. Is that right?
Teleport,
Maybe, okay.
yes,
Teleport
I
some
like it.
specialists
All right.
onto the pediatrics floor to help take care of some of those patients with more complex presentations, perhaps.
And that would allow you, I guess, to keep the patient here in
Yes.
Farmington while the medical professional can be somewhere else, but also offer their diagnosis, I suppose,
Right.
remotely.
Yes, and their expertise, yes. I can't remember if we've talked about it on this program before, but up in our nursery, we've partnered with the neonatology team at Presbyterian in Albuquerque. So we routinely keep premature babies down as young as 32 weeks upstairs. So we are, as I said, trying to expand our capability and keep people closer to home for a more broad range of presentations. And so to your point earlier also, if you live in some of the outlying areas still within this Four Corners region, keep us in mind, if, should those things come up, and, we're ready for you.
Right. And I would think that any family who's had to travel out of town for medical care or for an extended period of time, that gets pretty old pretty fast, making that drive and being, plus with the stress of worrying about your sick child, family member, whatever the case may be. I mean, that's just a struggle, I would think,
Yes.
for a lot of families to be able to do.
It's a big burden. We fly them. Obviously, they need to get to a higher level of care, but we don't fly them back. They have to find ways, and it could be a single mom. It could be so many different situations. So it's nice if we can keep them here safely. The other thing that is important is a lot of people don't realize pediatrics encompasses this huge range, like 0 if they are discharged
Right.
from the newborn upstairs on the 5th floor and they need to be hospitalized, they'll come to our unit frequently. So 0 to 17, we have all of the developmental ages that our nurses trained to take care of. So
Right.
Yeah.
And that's important things too. And I would imagine even in that age range, there's a lot of different types of illnesses and things that can present to a professional, healthcare professional.
Oh, absolutely. Yeah. You name it, we see it. Yeah.
Right. But still different than an adult with
Still
the
different
same
than an
issues,
adult.
right?
Yeah.
Even if you're 17 years old, you're still kind of different.
Yeah, you're still kind of different, although we are increasingly seeing some adult problems in that age group. Namely, I'm thinking things like diabetes,
Right.
and high blood pressure, and some of the other conditions historically thought of as adult presentations. So here we are back to the good sleep and good nutrition that we talked
Right.
about when you're 3 or 4 months old.
Right. Very true.
Yeah.
Very true. Well, we have the holidays are coming up, and we have just a few minutes remaining this morning in our conversation. Any words of advice over the holiday season, as folks, kids come home from school, and maybe they're not hanging around with as many friends as they were when they're in school or visiting family across the country or in other parts of the state? Who knows? Any words of advice to stay healthy? And
Yeah, I would just reemphasize, of course, it's the holidays, have fun, have a few more late nights, but make sure that overall we're doing a good job with eating properly and getting some exercise, and, increasingly video games, I think, tend to take over our holiday times, particularly when the weather's not pleasant outside. So try to find some time to get a little bit of physical activity, ideally every day if you can. Eat a few vegetables with all that Christmas candy and cookies, and make sure that we're getting adequate sleep.
okay, very good. Melanie, anything to add to that?
I do not. Lots of family time.
Right, that's
Yeah.
important
Being
too.
thankful for all of the things that we have.
That
Yeah.
can be
Absolutely.
good advice as well. And I always hear too sometimes that maybe kids need some structure. Is that also part of this? Maybe even if they could stay up late, but they still need maybe time to go to bed now, and you can't stay up to finish that quest or whatever it is
Right.
you're doing.
It'll still be there tomorrow.
Yes.
That's right. Structure is important, and of course, the sort of the guardrails and the advice will vary based on the age of the child.
Sure.
You know, younger children and, you know, children with things like ADHD and autism and things, you know, those kids respond really, really well to good, firm boundaries. And as they get older, you know, developmentally typical kids, as they get older, yeah, we can flex the rules a little bit.
Yeah.
But in general, yeah, there should be some guardrails. You don't get to give up your parenting responsibilities.
Right. Even at Christmas.
Right.
That's true.
Yeah.
Very good.
Yeah.
Well, thank you both for coming in this morning to talk about the new Pediatrics Unit. We can still call it new. It's less than a year old, but it's
Yes.
very exciting to see it. And congratulations on getting that done and that project accomplished. And I know there were a lot of community members who helped make that possible with their donations and their support.
Very
So,
thankful for that.
Yeah, absolutely. I would just echo that too. Yeah, thank you again to everybody
you.
that participated in that. The Marion family, who the namesake is for the unit. Yeah, we couldn't have done it without the broad-based participation of this, you know, this fabulous community we live in. So we're trying to make you proud.
right. Very true. And I think that's happening. So thanks for sharing the stories with us. Appreciate it very much.
Thank you for
Yes,
having
thank
us.
you.
You're welcome. Merry Christmas and
Christmas.
Happy New Year to
Christmas.
both
Yes,
of you.
likewise.
Thank you.
You bet. We'll see you soon.
Sounds good.
My guest this morning from